My apologies. Aloha, welcome to Hawaii Care Choices Healthcare Talk Story. I am Tish Lopez, your moderator this morning, and on all of the talk stories that we have. I did forget to mention last month, Talk Story made 2 years old. A deep mahalo for your to our dedicated participants that join us every month. We do see you. For those of you just joining in today, we are so glad you are joining us. Happy, beautiful Aloha Tuesday. Let's get started. Today's Zoom meeting is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. For those of us joining on Zoom webinar, the bottom of your screen should look like this. Please click on the chat box and say aloha to everyone here. Let us know what you're doing for this upcoming Memorial Day weekend at the end of this month, right there in that chat box. Healthcare Talk Story is an interactive presentation. We'll be asking you questions throughout the presentation, so please use the raise your hand button to send us feedback. Lastly, please click on the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, thank you for joining us and aloha. Please send your comments to say aloha and let us know what you are doing for Memorial Day weekend. Feel free to chat in questions as well as share your reactions with us during this talk story using your reaction buttons. We love to see the hearts, thumbs up, even the care button. And also feel free to to share the live video with your friends as well. Talk Story is an interactive presentation for you. Again, use that comment box throughout this presentation. We are also doing polls today. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. So polling is very simple. When you hear the brain teaser bell, a question will pop up on your screen, similar to what you see here. Please make the selection you think is best and submit your poll using that bottom button there. Just to get you comfortable and kick things off, let's try an icebreaker. All right, there's that icebreaker bell, and we got a question up on the screen. What beverage did you drink this morning? Is it water, coffee, tea, juice, or possibly maybe you're fasting and you didn't drink anything today? Please click on the answer. I apologize, you can't click multiple ones like me. I've had water and coffee, so but feel free to choose one and click the submit button below. All right, we got our answers in. I'm going to end the poll right there and share the results. So it looks like we got a 50-50 split. We have water 50% and coffee 50%. Thank you so much for engaging in our polls. And it is that easy. I can tell you all, you guys definitely all had your coffee like I did this morning. All right, before I introduce our guest speakers, I'd like to take this moment to circle back to those who are unsure of their plans for Memorial Day weekend, and even those who may be able to change those plans. Hawaii Care Choices is very excited to invite each of you to the 18th annual Celebration of Life Lantern Floating Ceremony happening in person on Saturday, May 28th, Memorial Day weekend. Please enjoy this short commercial about our event. Aloha. It is with heartfelt joy that we welcome all of you to join us on Saturday, May 28th at Reeds Bay for the 18th annual Celebration of Life Lantern Floating event at sunset. Luminaries to decorate available online now.
This year, there will be a special memorial tribute to honor our late former Mayor Billy Kinoy and all of our loved ones lost. Hawaii Care Choices welcomes all of you to join us for this very memorable celebration in person once again.
All right, we hope to see each and every one of you at Reeds Bay for the Celebration of Life on Saturday, May 28th, starting at 3 p.m. There will be free parking at the Affliction and Civic Auditorium, lots of free shuttles, also sponsored by HCEOC to Reeds Bay. For more information, you can visit hawaiicarechoices.org/celebration of life. All right, let's get back to today's talk story. I'd like to introduce you to our guest speakers. First up, celebrating 6 years at Hawaii Care Choices, she is responsible for educating healthcare providers, medical staff, patients, and families on the many services offered by Hawaii Care Choices, striving to raise the awareness about palliative, hospice, and bereavement care in hopes to provide world-class healthcare choices and solutions for all. Her magic sauce is human compassion, which is also often missing in healthcare. She educates while sharing her own personal experiences, offering an easy to understand view of how people can still have quality of life while living with serious illness. Please help me in welcoming Lani Weigert. Aloha, Lani.
Aloha, everyone. Thank you so much for joining us. Really appreciate it. Welcome.
Also joining us this morning is a woman who understands that a diagnosis of cancer, kidney, heart, or lung disease can significantly affect the emotional health of patients, families, and even their caregivers. On a daily basis, she helps others process common feelings during this life-changing experience, including anxiety, distress, and depression. She emphasizes the importance of recognizing those changes and getting help when needed. Please give a virtual round of applause for Hawaii Care Choices Bereavement Counselor, Laura Dvorak. Aloha and welcome, Laura.
Good morning. Thanks for having me.
This morning on Talk Story, Lani will deliver an engaging presentation utilizing her own personal stories to explain which services are covered 100% under the Medicare benefit. Next, we on Talk Story with, we will talk story with bereavement counselor Lani Dvorak on how serious illness can infect one's emotional and mental health and where you can get the support you need. I am so excited for all of you to be on Healthcare Talk Story. Friends, here we go. Please give a warm virtual welcome for Lani Weigert.
Thank you so much, Tish. And thank you for giving that special announcement. I hope everybody decides to come and be a part of something so uplifting like that. And I really appreciate that you were able to share that right as the start of our talk story today. And let's get onto it. There's just so much for us to unpack. If for any reason you folks can't see the complete screen, you can go ahead and minimize your photo boxes over there on the side or wherever they seem on your screen so that you can see the complete screen. Anyway, I'm going to talk to you folks today about different programs that we have that will absolutely affect and improve the quality of life for anyone, whether they're on this presentation today or for someone you may know that is dealing with a challenging, serious illness. So let me explain to you about the different programs. First of all, palliative care. A lot of people don't even know what the word palliative means, but it actually means to palliate, which is to soothe, to ease, to relieve, and to alleviate. So it's very, very much relief focused. And on palliative care, people are normally dealing with serious symptoms because of the type of illness that they're dealing with. So for example, somebody that might have cancer who is doing chemotherapy will have different symptoms that really they will need relief from. And that's where palliative care comes in. It's quite a specialty type of care. It is different from routine care. And for the most part, doctors are just starting to really bring that into the practice now. And it's so important for me to share this with you because many of the people that come on to this presentation will actually ask their doctors about palliative care and go ahead and get the care that they need for their loved ones or themselves. Now, palliative care is a very, very large umbrella. In fact, hospice care is a subset of palliative care. And normally what happens is when people are now transitioning towards end of life, they require the highest level of care. The Cadillac of services is what I call it. And normally they will transition to hospice care. There are often times where people will get hospice care and then graduate out of hospice care because they just get better. I mean, that truly is a testament to all of the great work that the nursing team does with the patient, that oftentimes they're able to graduate off and then maybe they'll come back to hospice care later, but for the most part, I want everybody to understand that death is not a requirement for hospice care. Okay, so it's important to know that quality of life is really what we're focusing on. And for hospice care, it's all about the comfort. It isn't about we're trying to do any kind of curative treatments. We're not going to chemotherapy, radiation, or dialysis anymore. We're just trying to focus on being with our loved ones and doing things that bring us joy. So palliative care, relief focused. It's about having curative treatments there. People are still quite active, but they're doing curative treatments on palliative care. And on hospice care, it's comfort focused. So quality of life versus quantity. And it's amazing how often that comes up and people are choosing one or the other, but they had no idea that hospice care was actually a philosophy more than a type of care. So again, for hospice, no treatments at that point. The illness just naturally progresses, and there needs to be a 6-month life guesstimate by the certifying physician, which is normally the primary care physician.
Friends, if you understand that palliative care focuses on relief and hospice care focuses on comfort, give me a thumbs up or raise your hand.
Thank you, Tish. How is palliative and hospice care the same? Well, besides the fact that they're under this big umbrella, the same umbrella, both relieve suffering, both can be delivered at the patient's home or wherever they call home, which could be in a residential care home as well. Both improves the quality of life for patient and their families, and both create a plan of care. And this is also called a goals of care plan as well.
Raise your hand if you think palliative and hospice care improves quality of life for patients and their families.
How are these two programs different? First of all, palliative care, of course, I told you already, it focuses on relief and hospice focuses on comfort. However, on palliative care, it does serve those with a serious illness of any age that could live for years, actually. So they're still going to canoe races, they're still going to Vegas, they're still doing family reunions. They are further up in the illness train. So what happens is many are seeking curative treatments and they could actually live for years. For hospice care, those are people who their physician has certified them to have, for his or her best guesstimate, 6 months to live. And so they are no longer seeking treatment. So you see, palliative care still doing treatments, hospice care no longer doing any treatments.
Give me a yes if you know someone that could benefit from hospice or palliative care. All right, there's that brain teaser bell. We have a question up on your screen. How is palliative and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, both creates a plan of care, or all of the above. Again, click the answer that you think is best. There's no right or wrong, and click the submit button below. We want to let everyone know, if you are tuning into Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month by emailing me at llopez@hawaiicarechoices.org, and I will send you the link. All right, we're going to go ahead and end our polling right there and share the results. So 100% of you said all of the above. Wonderful. Thank you so much in engaging in our polls. Back to you, Lani.
Thank you so much, Tish. And thank you, everyone. That is absolutely the correct answer to this. And I share with you that your task today, once you learn all of this, is to please go out and tell your neighbors, friends, and family, because you are learning something that many people have no idea even exists. Congratulations. Good job, everyone. So signs that palliative care is needed. First of all, we all don't have a clinical background. I just don't assume that everybody does. However, there are some physical things that one can see is changing in either themselves or a loved one. And some of these things are listed here. So if someone is going to the emergency room frequently, and frequently means they may go more than once during a month. I mean, when somebody goes to the emergency room once every 6 months, that's a lot. But when you seem to notice that a loved one is going more than that, then that's time to call the doctor for sure. Difficulty in managing medications. And this happens because there's so much medication. After a while, it becomes quite confusing as to which one to take. Diminished activities of daily living. So managing the finances, whoever is still doing a checkbook, okay, that's going to be challenging to do that. Or all of a sudden going online and just buying all kinds of things that they don't even remember that they bought, going grocery shopping and not really knowing why they're there, or even preparing light meals, doing housework, and even trying to drive is a concern. So these are things that you can see immediately is taking a change. So that's one thing. Also, when there is frequent pain or fatigue, swelling in the feet and legs, nausea, these are also discomfort signs that maybe more care is needed.
Friends, raise your hand if you know anyone with one or more of these signs.
So when should palliative care begin? In speaking to our medical director, Dr. Dolan, she strongly recommends that at time of diagnosis, it's important to already reach out and get help. So a lot of times people will say, well, I'm not having any symptoms, so there's no reason for me to call. But just picture this, and maybe some of you are already quite familiar with it. A person goes to the doctor and is given a diagnosis of cancer. They come home and they're just dealing with so much fear and anxiety and all these other kinds of emotional feelings. For the most part, for palliative care, a huge part of it is psychosocial, where people are dealing with a lot of emotions and they need help in trying to understand what is happening. We find that people are going to the emergency room largely because they don't really understand what their illness is and they're having anxiety over it. However, when education comes into the home and everybody understands, normally steps are taken to ease whatever that discomfort is, and there doesn't have to be a crisis about it. So again, having palliative care come into the home as soon as a diagnosis is really something we highly recommend. And by signing up early, those with serious illness could really actually live longer. And it's because they wouldn't be dealing with so much stress or dis-ease.
All right, friends, we want to hear from you. Please type true or false. By signing up early, for those with serious illnesses could live longer. True or false? Type that in the chat or the comment box.
Oh, thank you, everyone. Thank you so much for listening on that. So questions that our palliative care team will ask when they come into the home. We'll want to know about if the patient really understands what their illness is. In trying to be a good patient when they go to the doctor, oftentimes a lot of questions are not asked. And it makes complete sense because a lot of people don't know what to ask. I just accompanied one of our nurses, and he was at the oncology center with one of our patients that has cancer. And he went in to the doctor's visit with her and her daughter, who's her caregiver. And in that very quick visit, our nurse was able to ask all of the concerns that the family had, but really didn't know in what way to ask it. And it was just an amazing visit because they were able, I'm talking about the family and the patient, they were able to get all of their questions answered. And it really curtailed the amount of anxiety they were dealing with when they first went in. So I'm saying really understanding about the illness has a lot to do with the education that the palliative care team will automatically supply. And so having somebody on the team come in early is really the way that the family wants to go. The other thing too is it's good to determine the approach of communication, understanding who in the family is going to be making decisions on behalf of the patient, in addition to the patient as well. Also, just different values that are important to the family would be good to come out at that time so that the palliative care team can really focus on making sure things are aligned with regard to the values and the priorities of the patient and the family. And it's good to understand too what the beliefs or practices are of the family as well.
Friends, is it important for you to understand about your illness? Type yes or no in the chat or comment box.
Medication review. So what happens with this couple over here? This is for real, where we have gone into homes and there have been that many jars of medication. And just know this, that not all the jars actually belong to the patient. The way that medication is given these days is it's very fragmented and in silos. So, a person could go to urgent care and get medication, and they could go to their primary care physician and get medication. Then maybe there's a crisis of some sort and they go to the emergency room and get medication. And then maybe they go to their cardiologist and get medication. So you can see that all the medication keeps coming, but nobody has an overview of all the medication that is coming to a patient. We've been in homes where a patient is taking more than 20 different types of medication in a day. But once we do a medication review, call the primary care physician who remains on the palliative care team, we're able to then just focus on exactly what medication the patient should be taking, and we help them fill their pill box too so that there's no confusion. A lot of times this medication, some belongs to, say, a deceased family member or a adult child who no longer lives there, and or somebody that has left their medication or expired medications. So this is a very, very valuable part of the palliative care team coming in to help the patient and family.
Friends, if you think medication review is important, please raise your hand.
So there's other services that our palliative care team brings in, and this comes from our social worker. So the social worker will go ahead and connect the family and the patient to different resources within the community that the family could benefit from or is just completely unaware of. The social worker can also help the patient and family fill out different insurance forms. So maybe the patient could qualify for Medicaid. And to me, Medicaid is a Cadillac of insurance services and coverages as well. And so not everybody qualifies for it, just to be honest. However, the social worker will know if somebody is, and if the patient does qualify for it, then the social worker will go and help them fill out those forms. Also the completion of the advanced healthcare directive. Anybody that is on any of our programs will have this done, and it by all means is probably the best, most valuable gift you could ever give your family, and it's free.
Do you think these additional services increase the value of palliative care? Please type yes or no in the chat box.
So how is palliative and hospice care paid for? That's something that comes up all the time. First off, palliative care is paid for through universal insurance. So whatever insurance a person has, except VA and Kaiser. They have their own palliative care programs. Therefore, that's where everybody goes to get theirs. However, for HMSA and United Healthcare and other insurance companies, they are able to get certain parts of their insurance covered with regard to services such as when the nurse practitioner comes to visit or when the social worker comes to visit. Depending on the type of insurance, the person could have a copay or may not have a copay at all. There are times where patients have Medicare and Medicaid, and in those instances, there is no copay at all. Normally, the copay could range anywhere from $15 to $25, depending on what the patient type of insurance they have. It could go all the way up to $40 for a single visit from the nurse practitioner or the social worker. So it really does depend on that. For hospice care at home is 100% covered by any insurance. So the amount of the robust services that come with the Cadillac of Services hospice care, it is phenomenal. That is completely and totally covered when it's hospice care at home by any of the insurance companies that one may have.
Friends, raise your hand if you understand how palliative and hospice care is paid for.
So why hospice care? Well, as people continue on their natural progression of their illness, at some point they transition to a time where curative treatments are no longer working, they're no longer effective, or possibly just based on the patient's priorities and values, they no longer want any type of treatments. And this is where hospice care, the philosophy of hospice care comes in, where people start to focus on the quality of life versus the quantity of life. And so when that happens, they no longer want any kind of heroic curative treatments anymore. They just want to focus on comfort and being together with their loved ones. Also, hospice is there to help those dealing with terminal suffering as well. And again, like I said, death is not a requirement, but it neither is it the enemy at that point too, when somebody is suffering so much from a particular type of illness. What's great about hospice care too is it really redefines hope for us, because it isn't about giving up. It's really about redefining what is important to somebody in their life as well as with their families. And hospice care normally comes in when the patient needs just the higher level of care, probably the highest level of care at that point.
Friends, let us know in the chat or comment box if quality or quantity of life is what you want for your loved one.
So it does. It definitely takes a village. Thank you so much, Mar, for answering that. I appreciate it. It does take a village for us to go ahead and lift all of these services with regard to hospice care. We have an entire team, as you see right on here. Hospice care supports the patient and the family, and that's really, really important. Why I tell you about that is because it isn't just about the patient. Oftentimes we see the caregiver getting very, very frail, and it's because they are really being taxed with different things that they maybe don't normally do. But we find that they're not eating, they're not sleeping, because they're really focused on taking care of their loved ones. Many cultural beliefs is that the family needs to take care of their own. However, I want you to know that if you want quality of life for you and your loved one, please call us early, because we can come in and take care of your loved one with expertise that everybody in the family just they just weren't raised to have that expertise. But also it allows a wife to be a better wife, a daughter to be a loving daughter, and so on. And when we find that we are the caregivers and we are everything else, it's so difficult to do a really good job and do it without becoming ill yourself. So again, we are here to support the patient, but really, we come in early, we can support the entire family as well. And it is all about the quality of life.
Friends, raise your hand if you think early patient sign up ensures more support and quality of life for all. All right, there is that brain teaser bell, and we got our question up on the screen. So, early patient sign up ensures more support and quality of life for all, true or false? Again, just go ahead and put your answer right there and click the submit button below. For those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month by emailing me at llopez@hawaiicarechoices.org or by visiting hawaiicarechoices.org/healthcare talk story. All right, we will go ahead and end the polls there and share the results. 100% of you said true. Early patient sign up ensures more support and quality of life for all. Thank you so much in engaging in our polls with us. Back to you, Lani.
Thank you so much, Tish. Thank you. So when is it time for hospice? Again, physically, you can see certain things changing. Multiple visits to the emergency room or doctor, a person is losing weight and they're becoming a lot more frail. So there could be increased falls, decrease in appetite or thirst. Maybe they don't want to even eat or drink anything at all. They seem to have difficulty getting up and out of a chair or even bed. They want to sleep most of the time. And they start to have recurrent infections, not only within the body, but even on top of the skin as well.
Friends, now we would like to share a personal story from our patient caregivers.
Every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, and so the doctor finally acquiesced. But the doctors, I think, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, by the doctors about Kupu Care so they can get them plugged in to the help they need. Otherwise, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for Kupu Care. And all the people in hospice were angels. They were wonderful, beautiful people, beautiful, so supportive.
Well, one of the reasons why we went to Kupu Care was that my husband had found out that his illness was probably going to be progressive and not curable, so he was a little anxious, and so was I. During that time, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, remember. He had spent a lot of time with the community, and so he wanted to spend more time with family. And I think Kupu Care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband Barry wanted.
Those are really interesting interviews that we had. One that rings so true is how doctors normally take a longer time to actually bring this up to a family. It's very uncomfortable for doctors to have the conversation with patients, and that's why these type of presentations are so vital to the quality of your life or your loved one's life. And it's because we need to take responsibility for our own health. And so when we defer to our doctor and just figure that, well, the doctor will bring it up when he or she knows that I need it, then we actually give away a lot of that responsibility to somebody else. And so I implore you to really look at your loved ones and decide if there is care that you would like. Please ask for it, because a lot of times doctors don't feel comfortable, especially if they think they might have made the wrong guesstimate. And doctors don't want to ruin their relationships with many of their patients, so oftentimes they don't bring it up. In any case, here on the Advanced Healthcare Directive, why it's so important, that's another reason, is because a lot of people don't have one done. But the healthcare directive is really about when you can't speak for yourself should something happen. So say if you got into a car accident yesterday and you're up at the hospital now, your family is all surrounding you, but you can't speak for yourself. And so they start to look at what directive did you give? What direction did you leave for them? And if there isn't one, then they start to negotiate that around your bed. And sometimes it doesn't work out well. In fact, most of the time. And it's largely because one person is saying, oh no, she would want this. And another person would say, oh, definitely not. She would want this. And then it just goes on and on. And that's why I say that leaving your healthcare directive is probably one of the most valuable gifts you could ever leave to your family. And all you have to do is be 18 years old or older.
Friends, do you have an advanced healthcare directive? Please type yes or no in that chat box.
And if you don't have one, oh, we have some very, very good friends at Community First Hawaii that do this on a regular basis. So go ahead, you can show your phone right to the QR code here, or you can just take down these numbers here and just call them, and they'll tell you when the next one is going to happen. And I see that Tish went ahead and put it in the chat as well. But these folks do such an incredible job for you to really understand about a advanced healthcare directive and actually leave with one completed. So it's incredible and it's free. So if you don't have one, go ahead and take down that information.
Absolutely. You can go ahead and copy that link right in the chat box, or like Bunny said, scan that QR code and sign up today.
So do I need a pulse? So some of you may have seen this green piece of paper, or maybe none of you have seen it, and that's okay. So the difference between a healthcare directive and a post is actually a doctor's order. So when somebody is dealing with serious illness, and normally people that have a post are quite elderly and frail, they will have a post and it's up on their refrigerator. So should anything happen and EMS needs to be called, they would immediately pull this form and they would follow whatever the order said on it. So this is quite different from an advanced care directive. The directive is a direction on what to do. An order is actually a physician order, which is very much different from the directive.
Friends, if you understand the importance of a pulse, please raise your hand. All right, we got that brain teaser bell going. My coffee's wearing off. I apologize. I'm going to launch this question right on your screen now. Where do I get my free advanced healthcare directive completed or updated? Registering online, calling Annie Mayetta or Sean, or all of the above? Please go ahead and put your answers right into that polling and click the submit button below. Again, for those of you on Facebook Live, you will not see the polls pop up, but we want to hear from you. Put that answer right in the chat box. All right, I'm going to go ahead and end the polling right here and sharing the results. 100% of you said all of the above. Wonderful. Thank you again for participating in our Hanaho brain teaser. Back to you, Lani.
Thank you so much, Tish. All right, so some of you may know of Pohaima Care Center. And if you don't, I just want to let you know that it's in the middle of town on Kapi'olani Street. This is not a long-term care facility. People come here to get transitional care. So what that means is if they are at home and they are on hospice, however, they are not able to manage their symptoms at home, we would have them come to Pohaima and we would help them to manage their symptoms. And once those are managed, then we will go ahead and send them home. I'd say probably most of the people that come here will also pass here as well. And it's because they are actively dying when they come to this facility. It is one of the most beautiful medical facilities ever in the state of Hawaii. And people that come here, if they're on hospice care, they'll already have that portion of care covered. If they have Medicaid, that will cover their room and board. But we are also able to get private pay for anybody who wishes to stay here that is on hospice and doesn't have Medicaid to cover their room and board.
Friends, please enjoy this virtual tour of Pohaima Lama.
Welcome to Hawaii Care Choices Pohaima Lama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace in quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Pohaima Lama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
And here is the areas in which Hawaii Care Choices provides care. So every place on this map that's in color is where we will go. So from Lapahoihoi Point to South Point Ka'u, we cover that entire, which is, you can see on the map, it's pretty much half of the island, and we will go that far. So it is really about providing and improving the care of those that we touch. And we provide that through support, guidance, compassion, and mind, body, and spirit care as well. And so this is where we come to provide our care. We only need a quick call, or you can even send us an email as well. And it would be quite a privilege and honor to go and care for either yourself or any of your loved ones.
Thank you so much, Lani, for your explanation of palliative care and how it can help. Thank you so much to everyone who engaged in our polls with us. I hope you all learned something today. I just want to send a friendly reminder. If you do have any questions for our presenters, feel free to put it either in the chat box or the Q&A box below. Moving right along on this beautiful Tuesday morning, we're going to switch gears to hear from our next guest speaker, Laura Dvorak, Bereavement Counselor for Hawaii Care Choices. Aloha, Laura.
Aloha.
Thank you so much again for joining us this morning. And we are going to jump right in to a question that I have. When people are dealing with a serious illness, how does that affect their mental health?
So when folks are navigating a new diagnosis, it can affect mental health in a lot of ways, not only for the person with the illness, but also family, friends, loved ones. It can bring up emotions such as fear, anxiety, depression. Some people are a little more dissociative. They kind of check out a little bit in order to kind of cope. And it can bring up attachment issues, like even from early childhood kind of things, just about how we get our emotional needs met and get our survival needs met and things like that. For a lot of people, it's really forces them to just kind of figure out their whole belief system over again. Like your values and your belief system really come into question and come into play. It forces people to reprioritize, and that takes a lot of energy, and it's stamina that they might not have because of what's going on physically. There's a lot of decisions to make. It's very easy to catastrophize and just go worst case scenario, which it's good to be prepared for those, and but it's not good to be there mentally and emotionally all the time. That can be pretty disturbing. And a lot of folks report just an inability to totally be in the present moment. So it is important to remember through one's own practices, and also through the support of others, just how to focus on what matters. It can also affect mental health, as far as Lonnie presented on advanced healthcare directives and pulse and wishes for treatment and end of life care. And sometimes there can be conflicts between what a person wants and what their family wants for them, and maybe they're not even spoken about, but that can be there, and that can certainly affect one's well-being. And then of course during the past couple years, with the pandemic, it was harder for some folks to get timely support, and even get into facilities in a timely way if they were looking at that kind of care. And then just a lot of if the person with the serious illness is, say, like the breadwinner for the family, or even the spouse or the caregiver, or the adult child is the caregiver, then you're kind of looking at, okay, how do we function on a lower income now? And that in a world and on an island where things are getting ever more expensive, the cost of living is rising, and wages are not necessarily rising at the same rate. It can be that can also be really challenging. So
Yes,
yeah.
definitely. Going back to, having all of these emotions and things, kind of thrown at you all at once. How does one help control that anxiety and fear? You touched a little bit on it, as far as just coming back to your belief system, but are there other things that can kind of help, control it, navigate through it? What would you say?
I think really, yes, I wouldn't use the word control. I would probably say navigate, because I think I feel like our own mortality, it's like the waves in the ocean. We can't control them necessarily, but we can navigate. I think really just slowing down to digest the news, and to take time for oneself, and kind of focus on what feeds you, along with that reprioritizing. Some people find that they don't have time for petty matters anymore, or certain certain things, so they want to focus on, like what the woman, the bereaved spouse in the video talked about with her husband. He wanted to spend time with the grandchildren, and so really just thinking about focusing on what you can control, which is somewhat of how you spend your time. And then also there's a lot of really skilled counselors in the community. Most take any kind of insurance, so just finding someone to talk to, even finding a neighbor or a friend, or just someone you feel comfortable with, and really identifying your support system, I think, is really important. And also one thing that works for some people, not for everybody, but making a worry budget, because anxiety is going to come up. It's natural, but maybe setting aside a certain time of day or a certain amount of time where that's okay. Just let yourself go to all the places in your mind that, but then that's it. And then the rest of the day, focusing on making a plan for your well-being, making a plan for treatment, and just enjoying life.
I really like that word that you said, navigating, right? Because you're correct. We can't control anything, but we can at least, navigate through it in a more positive way as we can. You mentioned in the last 2 years, gosh, it's just been so hard for so many people, right? Dealing with the loss of life, loss of routines and jobs. And you mentioned there are other people in the community, but I'd like to go back. Are you able to support our community members as Hawaii Care Choices? Do you do just people that are on hospice services?
No, so I'm actually I coordinate the community bereavement program, as well as supporting family members for folks who lost somebody on that was on hospice care. And so we have anybody is welcome to reach out to us for one-on-one and group support. It doesn't matter, anyone in East Hawaii. We even have some folks that we support across the island because their hospices programs shut down during COVID. So being able to go on Zoom for a period of time helped us kind of expand our geographic area that we were able to serve.
That is so wonderful. Okay, thank you for sharing that. Laura, can you please expand a little bit more on what grief is?
Yes. So grief it's what we're thinking and feeling on the inside when we experience pretty much any loss, but including, when somebody that we love dies. And it can also extend to, maybe we lose a place that's special to us because of, a lava flow or a fire, or we lose a relationship ends, things like that can cause grief. When we lose a pet, a family pet. And some of the feelings that come up are, fear, loneliness, panic, pain. And then mourning is a little bit different. It's the outward expression of that grief. And there's different types of grief as well. There's some people have like delayed grief where, they're not able to kind of feel everything, as it's happening, but maybe it's a little bit later. And that can be for one's own, protective kind of functioning. There can be anticipatory grief, especially when there's a new diagnosis or a health serious illness concern. And then there's what's called complicated grief, which is actually, I think it's a newer diagnosis in the DSM-5. And that is technically when it's been longer than 6 months since a person experienced a loss. But I tend to, kind of believe that, there's never a time, there's not a certain timeline, there shouldn't be a certain timeline, and grieving is not a linear process. So whether it takes someone 3 months to kind of, move on and find purpose again, or 6 years, it's just kind of, it can really differ from person to person depending on all sorts of things.
Well, thank you so much for explaining all of that. I had no idea that there was so much just in grief in general. How can healthcare providers best support those experiencing grief?
So I think really just taking the time to show that they care, that that the patient and the family, they're more than just a number, and understanding the nonlinear nature of grief. That one week somebody might be kind of more accepting, and then the next week, for whatever reason, it's really hitting them harder. Always check for understanding. Just because someone's quiet or nodding in a conversation doesn't mean they understand. So kind of putting it back of like, when you're having these conversations, what is your understanding of what's going on, to really let them have a chance to explain what they understand about what's happening. And I think educating oneself as a healthcare provider about resources and referrals, you know, that kind of puts the onus on even, doctors and nurses about almost having to have function as a social worker too, of like, oh, I'm going to refer you here, I'm going to refer you there, but leaning on social work services and leaning on counselors as well. I think also offering interventions that are culturally responsive, that are strengths-based, that aren't just based on deficits, on statistics, on numbers. And then I think really at the forefront of community well-being, especially in Hawaii, are cultural practitioners as well. So really, not just people with the title of doctor, but people with the title of kumu and kahu, I think that's really important too. Yeah.
Okay, wonderful. Thank you so much. I know you talked about it a little bit, but we do have a question from the audience. What kind of support will help in specifically end-of-life situations for those dealing with grief and anticipatory grief?
So we have a whole team when someone's on hospice care specifically. We have a whole team of social worker, nurse, CNA, and then spiritual counselor as well, just to kind of sit alongside that person and or that family, and just kind of sit with some of those bigger existential questions, and really get to the root of what matters to them, how they can focus on that rather than being consumed by the worrisome aspects. And yeah, I mean, some of the practices and some of the things might be obvious to people that aren't really in that process of really navigating, but having someone just kind of to listen and just be a witness, and maybe make suggestions, but maybe the person's not looking for advice, maybe they're just looking for companionship.
Okay, that is wonderful. Thank you so much for explaining that. I have another question from a Facebook Live participant. I work with families who have loved ones living with Alzheimer's disease and other dementias. Some of them share that they feel that they've already lost their loved ones as they enter the later stages of the disease. Is community bereavement appropriate for them if their loved ones are still alive?
That's a great question. I think to some extent, as far as one-on-one support goes, absolutely. There might be, when you're looking at a support group, it might be more appropriate for all the members of the group to kind of actually be on the other side of they've already lost their loved one, because sometimes there can be it's just a different experience. But that's a very, very valid point about when people have Alzheimer's and dementia, when the memory goes, and there's loss of memory, there's loss of cognitive function. That's what's called, what the family members are experiencing is ambiguous loss, which is a loss without kind of like, there's not like a marked point where the person's still alive but not and being cared for, but they're not how their children might remember them at kind of when they were fully functioning and before the disease process took place. So a woman named Pauline Boss actually coined that term, ambiguous loss, and it can apply to so many different situations, but it's a really kind of unique form of grief. So but yeah, I'm happy to connect with anyone from the community. It's not just bereavement, but like really any loss that's going on. And if I don't have the answers, I'm happy to try and find somebody who does, and the resources that are available.
Thank you so much, Laura. We definitely appreciate that. You mentioned a little bit about the length of time that someone can experience grief, whether it be 3 months, 3 years, 6 years. Why does it take longer for others to get through grief? Are you able to kind of explain a little bit more, or is that just an individualized? Um,
Well, yeah, like I mentioned, the nature of grief is very nonlinear. Some people, I think part of that is maybe right after a diagnosis or right after the death of a loved one, people get all kinds of support and all kinds of phone calls and casserole dishes and all kinds of attention. And then after a few weeks, that tends to kind of decrease. And also even, there's so many tasks that are present to attend to, paperwork and planning a memorial service or a funeral, calling people and letting them know, this huge expenditure of energy. And then sometimes for folks, it's really weeks and months later that actually they're really feeling the grief and the absence and the quiet of, especially if they were a caregiver, if that was their focus for months, maybe years, was caring for their loved one. And then all of a sudden, oh, I'm supposed to care for myself now, but it's like when you're feeling brokenhearted, that's really hard. Um, and then for some folks, they might be kind of feeling, it might be smooth sailing for a little bit, with the right support and with some time, but then perhaps a birthday, holidays, and a certain anniversary comes up, and that can be really hard, whether it's the first one or the 10th one. Yeah, so there's no, and some people say, I have folks asking me, is there something wrong with me that it's been 2 years and I'm still, feeling this way? And then I have folks asking me, it's been 6 months and I'm, I'm back to normal. Is there something wrong with me? And it's like, no, there's not at all. For each person, there's no prescribed length of time. There's no prescribed like how it's supposed to look. So I think it's just important to remember that.
Okay, definitely good to know. Thank you so much for explaining that to us. Earlier in our talk story, I invited everyone for the Celebration of Life event. And largely it is to honor our loved ones who have passed, that decorate a lantern. In your professional opinion, why is physically releasing the lanterns for a loved one who has passed proven to be healing for those who are able to attend?
So I think just the experience of being witnessed and supported by the others, by the collective, knowing that you're not completely alone in your loss, that other people have grief and loss and death touch all of us at some point. And then I think really just creating that physical representation of the relationship that you have with your loved one, because even though they're not here anymore, the relationship does live on. And especially if we nurture it, if we feed it, it kind of has a life of its own. I think also when I ask community members and families of hospice patients how they cope and when they feel most connected to their loved one who has passed, it's often about connecting with nature. It's about being by the ocean. It's about feeling the breeze, it's about, yeah, like nature is a big healer. So I think, the lantern floating is like, it's like all the elements are there. You've got the water, the air, the fire, and then the earth as well. The lanterns are collectively burned after the fact and everything. So I think also just returning to collective ritual around end of life and death. I think all cultures have that to some extent, and some have been lost over time. But I think coming and creating our own with the community that is on Hawaii Island is a really beautiful thing to participate in.
Right. Thank you so much, Laura, for sharing your insights on that. I would just like to say thank you so much for joining us at our talk story again and your valuable insights to grief and all the different terms with ambiguous grief and anticipatory grief, and that we all go through it. You know, it's something that we all have at one point in our life. So we're so thankful that you took your time out in your busy schedule to join us. Are there any last comments that you would like to share with our audience?
I do just have a couple of, I guess, announcements, some dates to share and some programs that we have going on in case folks are curious.
Yes, please.
Okay, so this is an overview of just some of the programs we have coming up for the rest of the year. So we have our adult bereavement support group. It's a peer-based group, and we have still decided to continue meeting on Zoom. But what we do is we will, during the 8-week sessions that happen, we will come together in person for one of those sessions, usually outside somewhere by the ocean, and so we can be socially distance and keep everyone safe and healthy, but still be able to gather in person. And folks have actually said that, even though a lot of people can be have experienced a lot of Zoom over the past 2 years and they're ready to be fully back in person, but it has really helped folks that don't live right in Hilo and can't drive in every week. And also with the price of gas and everything, it's helpful just to be in the comfort of one's home to have this group. For folks who really do prefer an in-person support, we have a walking grief group coming up that is going to be Thursdays in June and July, and that's also to help accommodate for folks who work during the day and can't make it until after 4:30. We are just wrapping up our spring children's bereavement group that's happening virtually right now, and then the goal is to return to in-person for the fall session. We also have a family retreat. It's a one-day experience called Camp Ohana, and that's in partnership with Liliuokalani Trust, and that's for any bereaved youth and their family members from kindergarten to seniors in high school. So we have different activities for the different age groups. And any of these you can call or email to register and to find out more information. We also have, I'm just gonna pull it up here. Oh, here's the flyer for the Walking with Grief support group. And then we also have a teen program called Rite of Passage that's going to be using, creative therapies, arts therapy, writing, poetry, visual art, music. And that is, one moment, that is May 20th. There's one session happening with that. And from 4 to 6 p.m., anybody can, there's still space, there's still time to sign up. And if there's a lot of interest, we will definitely offer more sessions of this, but we're just kind of trying it out for now. And it's going to be happening at the Kukuau Studio in Hilo, which is a really just fun, colorful environment. So I look forward to that. And anybody, yeah, like I said, anybody can reach out over email or phone to register to find out more.
Wonderful. Thank you so much, Laura. Gosh, there is so many ways that people can connect and just get the support that they need. So I really appreciate you doing that for our community. If you could please just write in the chat box for everyone your email address and or a number that they can contact you at, that would be super helpful.
Absolutely.
Wonderful. Well, mahalo again, Laura. Again, we're so happy to have you on Healthcare Talk Story, and we hope that you have a great rest of your day.
Thank you so much. You as well. Aloha.
Aloha. Thank you so much for everyone who has joined us this morning on Healthcare Talk Story. A very special mahalo to our guests, Lonnie and Laura, on their valued time and helpful perspectives that were just shared in the Healthcare Talk Story today. It was kind of a heavier topic, not one that many people talk about, but it is important to talk about it as well. If you have any specific questions about your loved one's situation, please reach out to us. We have a very helpful team standing by that will help answer your questions. Call us at 969-1733, or you can email us at care@hawaiicarechoices.org, or you can also reach Laura at bereavement@hawaiicarechoices.org. Or you can ask your doctor if palliative care is right for you. Our hope is that you receive the right care at the right time. All right, there's that bell again. For those of you joining us on Zoom, there will be a quick survey that will pop up on your screen. Please make the best selection possible. Oh, a double bell. Please make the best selection possible for all 6 questions and then click the submit button below. It is anonymous. It will not be shared. And we would just like to get your feedback on our presentation today. Your input will allow us to gain a better understanding of how we can better serve our community with presentations like these in the future. So that is coming up on your screen right now. Awesome. For those of you on Facebook, please send your thumbs up or your hearts. If you enjoyed this presentation, send a mahalo or a thank you to all of our guests. All of you are invited for next month's Fully Engaged Zoom presentation on the 10th at 10 a.m. Just email me, llopez@hawaiicarechoices.org, or sign up on the Facebook page. I'd like to add thank you, Lonnie, again for a great presentation of the palliative care. I know many have heard Lonnie speak before, and I'm sure I'm not alone when I say that it's always very informational and entertaining. Lonnie, while they're doing their surveys, I'd like to ask you, in what ways can people participate at the Celebration of Life event?
Oh, so we're looking for volunteers to come and help us. There is an entire list of different tasks and jobs that we have. And by just going to our website and clicking on Celebration of Life, you can go ahead and scroll down to the volunteer tab and click on it, and it shows a whole description of the different things that we have. So right now, what comes to mind is the ocean sentries. And I think, Laura, are you going to be a ocean sentry for us this month?
I am. I'm going to be out there on my my one-man outrigger, making sure the luminaries don't go out to sea.
That's awesome. So when I think about that, I really encourage anybody who either knows somebody that has either a kayak or a stand-up paddleboard or even a surfboard to come out and join Laura out there in Reeds Bay as she is creating her own human chain to go ahead and block any of the lanterns so they don't go out to open sea. So that's one of the super cool positions that we have at this Celebration of Life. The other thing too is this is a community event for everyone. And it's like Laura said, when you're out there and you're shoulder to shoulder with your community, you realize that you're not in this alone. And I feel that the only way that we can get everybody out there is if we simply ask. So I hope that you will consider to come out and join myself, Tish, and Laura as we're out there on May 28th doing this wonderful, wonderful gift to our community in trying to uplift everyone, especially after the last 2 years.
Thank you so much, Lonnie. Are there any last words that you'd like to say to our audience?
Well, I'd like to really thank Laura for just jumping in here and talking to us about grief. Can you share with us a little bit, Laura, about what happens over Zoom should somebody decide to join in one of those community sessions?
Absolutely. Yeah. So our group runs for an hour. Um, it's an hour long, and we usually have kind of like a check-in. We'll start with, you know, maybe like a breathing exercise, or just kind of to get everyone's coming from different, you know, spaces and places, right? So just to kind of get us all arriving together in that virtual space. And then folks usually just check in about what's present for them, what's alive for them, what's hard, anything that's up. And then often we'll have an activity, like a structured activity, like a journal prompt, or, you know, we've listened to music or watched a movie clip together and just kind of, you know, talked about what it's brought up and things like that. And we have, there's different kind of art, more artistic activities that we've done as well. And then yeah, it's I also like to leave it somewhat open, because yeah, there might be someone that needs to check in a little bit longer one week or ask for resources. Yeah.
I'm glad that you brought up about a possible art project, because we found that with the children's bereavement, often it's more easy for them to express themselves through art of some type. And at the celebration of life, we are happy to have different animal masks for the different children and even the adults, if that's what they want, to color their masks, because maybe sometimes internally they're dealing with different emotions, but can't quite, express what that is. So maybe that day they feel like they're a tiger, or maybe they feel like they're a dog or a bunny or whatever that is. But it really does bring some solace to the children. And do you find that that's sort of similar with the adults as well?
Yeah, I think so. I think when we engage our creative energies, we can get in touch with things in a way that we weren't able to maybe put into words or put into writing. But oh, you know, colors and pictures and sounds, that sure does, you know, help us feel things more deeply, or help us just kind of move things that were stuck.
So I want to invite everybody, bring your families, bring your kids down and do something really meaningful together at Celebration of Life, while the kids just have their time with all these different animal masks and are able to color and express themselves. And even as Laura shared too, with regard to letting go of the lantern in Reeds Bay, that sort of attachment that people have with those who have gone. Now, in the Japanese culture, with regard to the lanterns, their belief is that letting go of the lantern there in the ocean is helping the loved one reunite with their soul. And so the letting go is a very big physical thing, but also quite emotional, as well, as Laura alluded to in her conversation with us. And again, I just say, if you really want to have a positive impact on your community and make a difference to give back, come and join us on May 28th, Saturday, between the hours of 3:30 and 7:30, so we can float a lantern together.
All right. Mahalo so much, Lonnie and Laura. And mahalo, everyone. If you feel that you have benefited from this presentation, please let your friends and family know that they're welcome to join us on the 10th of every month at 10 o'clock. Just RSVP to myself for the Zoom link, or tune into Facebook Live. Also, again, you are all invited to the Celebration of Life happening at the end of this month, Saturday, May 28th. Mahalo again for joining us. See you all next month right here for Healthcare Talk Story. Aloha.
Aloha, everyone.
Aloha.